This is our third video in the renal series, and this one is going to discuss alterations of renal and urinary tract function in the pediatric population. Structural abnormalities that appear in the pediatric population are horseshoe kidney, where the kidneys are fused, so it's a single U shape. Hypospadias, where the urethral meatus is located on the ventral side. Chordee, which is penile bowing. Epispadias, where the urethral opening is on the dorsal surface of the penis. And exstrophy of the bladder, which is a herniation of the bladder through the abdominal wall. This is what hypospadias looks like. You can see the urethra is here and not here where it should be. So structural abnormalities can include these: bladder outlet obstruction, uteropelvic junction obstruction, hypoplastic or dysplastic kidneys, polycystic kidney disease, or renal agenesis, or Potter syndrome. With renal agenesis, the infant is born with kidneys. They either don't have kidneys, there's the absence of kidneys, or they are born with kidneys that do not function. And this is an incompatibility with life syndrome. So infants born with renal agenesis will not survive. Glomerular disorders. We have glomerular nephritis in the pediatric population. Commonly occurs post-strep. So this is occurring after a strep throat with certain strains of group A strep. You'll see a sudden onset hematuria, edema, hypertension, and renal insufficiency. Immunoglobulin A nephropathy, nephrotic syndrome, and hemolytic uremic syndrome are all common, not common, but disorders that occur in the pediatric population. Acute post-streptococcal glomerulonephritis, antigen antibody complexes and complement are deposited in the glomerulus. The immune complexes initiate inflammation and glomerular injury. And this needs to be identified very quickly as to not cause permanent kidney damage. This is glomerulonephritis. Immunoglobulin A nephropathy is characterized by a deposition primarily of immunoglobulin A and complement proteins in the mesangium of the glomerulus. Heineck-Schlamm purpura nephritis is a form of IgA nephropathy that involves a systemic vasculitis and palpable purpura. You can see these IgA, they're all immune mediated. So whenever you see anything that's IgA, that's immune mediated. Nephrotic syndrome is a symptom complex related to the loss of protein in the urine. Minimal change nephropathy, focal segmental glomerular sclerosis, congenital nephrotic syndrome. Nephrotic syndrome can be primary or secondary, and remember, primary and secondary differ because secondary occurs due to something else happening in the body. Onset can be insidious with periorbital edema as the very first sign. So swelling around the eyes may be the first sign of nephrotic syndrome in the pediatric population. Hemolytic uremic syndrome is characterized by hemolytic anemia, thrombocytopenia, acute renal failure. It's the most common cause of acute renal failure in children, and you're going to see this in children who have it's like salmonella or E. coli in the blood. So this is a very serious, deadly process that can occur in children who, we see this with kids that have been invaded with salmonella and E. coli sepsis. The bacterial toxin from E. coli damages red cells and endothelial cells, and the endothelial lining of the glomerulus becomes swollen and occluded with fibrin clots. Now, the only thing we can hopefully do with these kids is put them on dialysis and hope that, and also, what the heck, I can't remember what it's called, where they do, it's right on the tip of my tongue, where they filter the blood, plasmapheresis. They perform plasmapheresis on these children to try to get rid of that damaging toxin. The damaged red cells are removed from the circulation by the spleen, causing acute hemolytic anemia. The microcirculation develops numerous thrombi. The manifestations of this: prodromal GI illness, sudden onset pallor, bruising or purpura, slight fever, anorexia. These kids have watery, blood-stained diarrhea. So anytime a patient, whether it's an adult or a pediatric patient, has diarrhea with blood in it, they just bought a ticket to the emergency room ASAP because they need to get checked out to rule this out. Early intervention is the most important thing to prevent death in these cases. Seizures and lethargy indicate CNS involvement. Nephroblastoma or Wilms tumor. Wilms tumor is an embryonomal tumor of the kidney. This was on your last test. Wilms tumor arises from undifferentiated mesoderm, inherited and sporadic forms, usually found by the parent due to abdominal swelling. So the patient presents with abdominal swelling, take it to the doctor, doctor diagnoses Wilms tumor, get rid of it, and it's a pretty the long-term effects are pretty good. The thing is, you don't want to mess with Wilms tumor. It's not the type of thing you want to feel and feel and feel, because that can cause it to spread. So we don't want to do a lot of abdominal disturbances to someone we suspect may have a Wilms tumor. Urinary tract infections in children are common between the ages of 7 to 11. E. coli is the most common pathogen, and the cystitis is acute and chronic. This is the one thing we need to rule out in children: retrograde flow of urine from the bladder to the ureters or kidneys or both. This can lead to frequent pyelonephritis. So these little kids are going to be referred to not a pediatric urologist that will do a voiding cystogram to see if there's any reflux occurring, and then they will be on preventative antibiotics for a little while, until this is one of those things that typically as they grow, it stops. This can be caused by congenital abnormality or ectopic insertion of the ureter to the bladder, and it can be repaired surgically if needed. Incontinence is the involuntary passage of urine by a child who's beyond the age of 4 to 5. When voluntary bladder control should have been acquired, there's primary, secondary, daytime, and nighttime enuresis with children. There are different theories associated with enuresis.